peace on earth.
Hate waiting at the doctor's office for something minor? Southwest Medical now has a way you can have a doctor make a house call virtually. It's a telemedicine option called NowClinic, and here with the details, Medical Director Eugene Somphone with Southwest Medical Associates. Good morning to you and welcome.
Good morning. Thank you for having me.
As you know, if you followed the news, it's no surprise that there is a shortage of doctors here in our state, and you're providing an option that makes it easy for people to see their doctor. Can you tell us about this?
Sure. We all know that Nevada ranks close to dead last in terms of physicians per capita. At Southwest Medical, we've been very aggressive in hiring new physicians. We've added new offices, new providers, urgent care centers, and 2 years ago we introduced telemedicine.
Can you tell us what telemedicine is all about?
Yes, telemedicine comes in different forms. At Southwest Medical, our NowClinic allows consumers with non-life-threatening conditions that don't always require an examination to connect with a provider via secure video or audio through use of their laptop, home computer, smartphone. The connection time is about 5 minutes. The provider will ask you a few questions, usually lasts less than 10 minutes. If a diagnosis is made and you need a prescription, it's sent electronically to your pharmacy. So we launched this about 2 years ago, and today we've conducted about 13,000 virtual consultations.
It's a great service because some people, they want to see their doctor, but they don't have the energy, or they just don't want to get dressed to go see a doctor, and it gives you really peace of mind as well.
Sure, this is so easy. A case in point, I had a patient come in about 5 a.m., young healthy female with a raging bladder infection at 5 in the morning. We did the visit in less than 5 minutes, and she was so ecstatic. And what she told me was that she was a single mother, 2 young kids, didn't have to roll out of bed, so very, very easy.
Now, what type of conditions can be seen with this NowClinic besides what she went through?
Sure, this is only not for every patient nor for every condition, but for certain things like bladder infections, respiratory infections, skin rashes, med refills. This is just a very, very easy way of conducting a visit.
You can do poison ivy, oak bronchitis, just a range of conditions too.
Sure, just about anything that does not require a physical examination. We know a lot of patients go to ERs when they shouldn't go there, or even urgent cares. This is a very, very easy form of access. It's super quick. Really, it's much cheaper for the patient and for the healthcare industry, period. And
again, how long did it take you to talk to this woman that was on the computer?
Yeah, our connection time is about 5 minutes. The consultation usually lasts less than 10 minutes.
So it's super fast. You're in and basically out. And it works like FaceTime if you have an iPhone. Basically, it's really secure audio and visual. And so it's sort of like a FaceTime visit, but it's secure. And with this, with a smartphone, you can visit from your bedroom, anywhere really outside the hospital. Again, you don't have to drive in urgent care, you don't have to wait. The co-pays are very, very low. Patients love the service. It's really one of our highest rated as far as patient satisfaction areas of care. And obviously the woman loved it that she could see you without having to get out of bed or out of the house. What other responses are you hearing? Well, I can tell you that every health insurer right now has a telemedicine practice either in place or in the works. Same with every major employer, every major health group in town. Patients love the service just because it's so quick and so easy and so fast. The co-pays are very low. Our patients love it. Our physicians love it too. It's just so easy for everyone to do. Yeah. Now let's talk about the new developments coming on here regarding the availability of NowClinic. Sure. In the past month or so, there's been state regulation changes allow Medicaid patients now the same access to telemedicine that our health plan have had for the last 2 years. So Medicaid now can access telemedicine. And you know that these Medicaid patients with the Affordable Care Act, we added 250,000 new patients to the state. Oftentimes they had no access to primary care providers or really any medical care. So now they have ease of access to simple conditions. Very nice. And when it comes to registering, downloading the app, do you see just any doctor that's available at the time, or is there a specific doctor? Can you see your own doctor if they're working? Well, our telemedicine right now is limited to acute care needs. Okay. So things that require urgent attention. So we have a panel of providers that you can access with just a click of your smartphone. So there's a list, you just select that provider, and they'll come on within about 5 minutes or so. And again, you have to download that app to get started. Exactly, and it's very, very easy. Just go to the App Store, download that. or you can go to Southwest Medical web portal and register that way as well.
You've saved so much time for 13,000 people that have used your services. It's incredible.
Exactly. And again, it's not for every patient or every condition, but I can tell you that over 13,000 patients with their mouse, with their smartphone, have told us this is the form of medicine that they want.
That is incredible. Well, thank you so much.
Well, thank you.
Appreciate your time. Be sure to try out Southwest Medical's NowClinic telemedicine for all your non-urgent needs. Just head to nowclinic.com for more details. To find the closest Southwest Medical to you, just call the number or check out the website on your screen. Also, check them out on Facebook and Twitter.